So we are on chapter 12, which covers substance use and addictive disorders. I'd like to first talk about tolerance and withdrawal, and then move on to a few specific substance use disorders. So, as you probably know, many substances can be highly addictive. Many substances we use on a daily basis are addictive. For example, caffeinated beverages such as caffeinated tea, coffee, etc. That's in the category of stimulants. And what happens is that when we begin to use a substance, if I have a cup of coffee for the first time, I will have the classic reaction, which is alertness, more energy, focus. I might get a little jittery, which can be a side effect, but I might feel like, wow, this is giving me a really nice big boost in my alertness, energy, and focus. Okay? And if I drink a cup of coffee for a week or two, I will discover that after a week or so, or maybe just a few days, I don't have the same boost. I don't feel the same level of alertness after that one cup of coffee. And that is tolerance. Tolerance basically means that we need more and more of the substance in order to get the same fix or experience. Withdrawal refers to the set of symptoms that people typically experience when they use a certain substance, and then they stop using it. So if I go back to the example of coffee, if I drink, let's say, 1 or 2 cups of coffee for a few years, and then I stop cold turkey, chances are I'm going to get fatigue, I'm going to be a little unfocused and distracted, maybe have a headache. Those are typical symptoms that a lot of people experience, and they intensify when we talk about more addictive drugs such as cocaine, heroin, opiates, etc. They can be extremely unpleasant, debilitating. They can also be life-threatening, okay, depending on the substance. I'd like to move on and talk briefly about 2 categories of substances. The first one is depressants. Depressants basically are a set of drugs that tend to bring down or reduce the activity of the central nervous system. So as a category, they tend to give us relaxation. They can alleviate pain. They make us less anxious. Okay, so this would include alcohol. Alcohol is, in small quantities, may not be harmful to most people. However, large quantities of alcohol that people use chronically can lead to very serious health problems. Not only an addiction, but also liver disease, dementia, etc., especially when we talk about chronic long-term use. In the same category, there are also certain anxiety medications such as benzodiazepines and barbiturates. That would be things like Valium or Xanax. Again, those can be highly addictive. Okay, should never be used in long-term ways on a daily basis. Some people use them as prescribed on as-needed basis under the supervision of a psychiatrist. That is okay, but again, it needs to be very clearly and closely monitored to make sure that people are not developing potential addiction. And then there are opiates. As you know, we are hearing in the news about people becoming very easily addicted to opioids. That's something that's come up in the United States in the past 2 decades or so. Again, opioids are the type of medications such as morphine, oxycodone, etc., that can bring relief both from physical and emotional pain, and that are highly addictive, and sometimes people can die of overdose. I'm going to pause here on the depressants and move on to stimulants. Stimulants is a category of drugs or substances that tend to lift us up. They give us energy, focus, okay? They can help us feel really, really able to tackle the world if we, such as, a few cups of coffee or Red Bull. But then certain types of stimulants can be very highly addictive, such as cocaine, methamphetamine, amphetamines, etc. Okay, these are drugs that tend to increase the activity of the central nervous system. I want to point out very briefly that stimulant medication for ADHD contains very small amounts of amphetamines. Okay, that is because it can stimulate the activity of the prefrontal cortex, which can reduce as a result some of the symptoms of ADHD. It can make people more attentive, can help them with impulse control, and with overall better self-regulation. I'm going to pause here and I will see you next time. Thank you so much for your attention. Bye.